I think, Medicare is extremely important. I think that it's a position or a philosophy we should stand on, utterly stand up for, and I think it's probably the greatest cultural asset, the single greatest cultural asset that we have. There's nothing, in my opinion, more important than the humanitarian aspect of caring for each other.
That our healthcare system doesn't belong to the BC Liberals. Our healthcare system belongs to British Columbians of this generation and future generations in our province.
Medicare is a very important privilege that we all have as Canadian citizens, and I think it's one of those things that all too often many of us take for granted until we actually need it.
I'm almost 91. Have you seen a list of the government employees cutting anything at all? No. They gave themselves a huge salary raise, and we let them.
What's going on with the healthcare system? Well, on the very bottom line, like underneath all of the cutbacks and all of the uproar about we need more money here or there, is the fact that the Canadian government, I'm talking about Alberta governments, BC government, the federal government, would really love to see private health care. They would very much like to see the places that they invest in make money off of our ill health. And that's the very bottom groundwork of what's going on.
There we go. Hold the sign up there. There's the other side here. We're going to sing a little song right now. I don't know why you hate us like you do. I don't know why, but you do. I don't know why you can't get it right. I don't know why, but you don't. You never seem to want our attention. Just promises, promises at election. I don't know why you hate us like you do. I don't know why, but you do. We cannot bear your cuts to health care. We cannot bear what you do. We cannot bear a long waiting list. Private health care we resist. We'll tell you what we all desire. Just don't set our health care on fire. I don't know why you hate us like you do. I don't know why, but you do.
We sponsored this event, the BC Health Coalition sponsored this event because we were approached by a group on Salt Spring Island called Save Our Surgeries. They're very passionate about the issues that they've been facing there on Salt Spring Island, and we realized that in fact their issues aren't unique, that we are seeing these cutbacks and broken promises from across Vancouver Island. And we decided as an umbrella group of the BC Health Coalition that we would help bring together activists from across Vancouver Island to bring their message to the steps of the Legislature today.
Thanks for coming today. I know there's a lot of communities other than Salt Spring affected by these cuts, these very deceitful cuts, and people have come a long way today. It's not a gentle day, but crowd together and keep one another warm. I was asked to speak because Salt Spring's operating room is now sitting empty. This is an operating room that not only provincial taxpayers but local taxpayers and our local hospital foundation spent millions of dollars building a brand new state-of-the-art operating room in the Lady Minto Hospital on Salt Spring. That was 5 years ago. 5 years ago, the Vancouver Island Health Authority came to the CRD board, and I was Salt Spring's representative on that board. They came to the board saying, this is our top priority for healthcare on Salt Spring Island, is to upgrade your hospital and to build this new operating facilities. 5 years later, it sits empty with no surgeon. I ran in the provincial election. I was obviously unsuccessful. It was one of the most deceitful elections I've ever witnessed in British Columbia. Our MLA and the health authority were telling us before the election that their priority was to get a surgeon to reopen the operating room. Now, after the election, they're telling us that we need to do a needs assessment, that maybe there's other priorities that Salt Spring has for healthcare, and this is the same entity, this is the same health authority that came to the CRD board just 5 years ago telling us that this was their top funding priority. So we put millions of dollars into that facility. Regional taxpayers, everyone who lives in the Capital Regional District, contributed to that facility on Salt Spring, and it's sitting empty. There are other speakers, and I want to move things on here, but I just want to say something about the funding and the cuts being made to healthcare. The Vancouver Island Health Authority shortfall of $45 million represents 1/10 of 1% of the entire provincial budget. It's a rounding error. So not only is the closure of this facility, the closure of other facilities in the province, not only is it deceitful, but it's completely unnecessary. Don't let anyone tell you that we do not have the financial capacity to deliver health care to seniors and other residents of this province. It's nonsense. So
healthcare in Campbell River is deteriorating all the time. Our hospital has been chronically underfunded, and we now have a pending crisis with our ICU because VIHA no longer funds locums. VIHA is looking to some other funding area for it. They should have been acting on it 3 months ago when they found out in January we were going to be having a pending crisis with the loss of one of the doctors who works in ICU. But VIHA is a problem. You cannot micromanage a hospital in Campbell River from Victoria. We do not have a local administrator. We do not have a local hospital board. And this is a major problem since we lost an administrator and a local board.
I think if Gordon Campbell cared about public health care, he would be making very different decisions for the citizens of British Columbia. I think he would not be cutting seniors programs that keep them in their homes and healthier for longer. He would not be proposing public-private partnerships for our medical facilities. And he certainly wouldn't be supporting the existence of private for-profit clinics across the province. So no, I don't think that Gordon Campbell supports public health care. And I think the sooner that he listens to what the citizens actually want, the better the direction of the province will go.
I am a nurse, and I've been a nurse for over 20 years. And I've been at the James Bay Community Project for 5 years. I've just recently graduated as a nurse practitioner just in September here. So James Bay Community Project is a primary health care facility, and this has been in operation for over almost 35 years. What this means is it's not for profit. It is board operated, community involved. And what we do there is we look after some of the most frail and marginalized people in the city, and that is through the ministry's own statistics. So we look after 2,650 people in an interdisciplinary team format model. And this is celebrated around the world as being the model of healthcare. It's called primary health care. And that is nurses, nurse practitioners, and physicians, all salaried, all working together and looking after the healthcare needs of some of the most frailest and elderly and marginalized in the community. So what I'd like to say today is this is wrong. We are going to be closing as a primary healthcare unit. And what happened was, like many of you out there, I'm also a casualty of these health cuts. I will be looking for work. There is no longer going to be a nurse at the facility, and that has set up a domino effect. With my position, the whole community clinic as a healthcare clinic is going to close. So